As Colorado's case numbers keep going up, the state is considering worst-case scenario steps if hospitals start to completely fill up. Denver 7's Megan Lopez is joining us live tonight. And Megan, the state has already taken some serious measures throughout this pandemic, but now it's talking about doing even more.
Yeah, that's right. And those emergency steps have fluctuated based on the spread of COVID and things like hospital capacity, staffing, and PPE. Now, over at Denver Health behind me, as of today, they're at 85% ICU capacity. Other hospitals in other areas of the state are much worse off, seeing 93, 95% ICU capacity. So now the discussions pivot to tough decisions that could be ahead.
Thank you all for attending this meeting.
This is not the meeting healthcare experts in the state thought they'd be having at this point in the pandemic. But with COVID cases on the rise, ICU beds reaching their capacity, and hospital staffing shortages, a discussion of worst-case scenarios.
These have never been applied to COVID. They've never been applied to kind of the severe strain we have now.
It's called Crisis Standards of Care, a guideline set by the state to give healthcare facilities more flexibility in how they operate.
It allows hospitals, other kinds of healthcare institutions to gracefully degrade their levels of service.
Colorado has used this practice before during the pandemic to ration personal protective equipment and allow staff to reuse PPE for EMT services, and even now for staffing challenges to change work hours and responsibilities. But never in this pandemic has a crisis standard of care been implemented for hospital-based decision-making on things like who to admit.
It means clearly we have institutions bumping up against their capacity limits, and they're under stress.
This is a framework that I put together in 36 hours.
During that emergency committee meeting Thursday, healthcare experts worked to update the standards they will send out to hospitals in case this is implemented.
We're not trying to predict mortality. We're trying to predict, will you be okay if you don't get this service?
Their discussion centered around three questions. How likely is a patient to survive and improve without being admitted? How likely is a patient to die even if they are admitted? And do they have access to some other type of care?
Eventually, it may have to be, how likely are you to survive? I mean, in a real dire straits, that may be how we limit it. But I think we're not there yet.
For now, they're preparing for the worst, hoping it doesn't get to that point. So something that was discussed during that meeting was whether vaccination status should be considered as part of those standards of care. And the general consensus among those health experts was that it should not matter. Socioeconomic status, however, would. So people who are experiencing homelessness, who don't have a place to go when they are sick, or people who don't maybe have somebody at home to help take care of them, they would be admitted more readily under these crisis standards at this point. Now, they're hoping to have a finalized list of those standards completed by next week, but again, they're really trying to not implement them just yet. I'm live. Megan Lopez, Denver 7.
All right, Megan, thank you. And today, Governor Polis issued an executive order allowing anyone over the age of 18 to receive a booster shot. And in that order, the governor says, given the current rate of spread in our state, everyone is at a high risk of infection.